Thanks for joining us at Mental Health Matters. I'm your host, Lisa Ann Butcher, and with me I have two guests today. We're going to be doing an amazing episode today about treating your trauma. My two guests today are Dr. Neru Sidhu. She is a registered psychologist, and she works with us at Three Sisters Counseling in Kelowna. She has extensive background in PTSD, treating trauma, eye movement and desensitization reprocessing, if you've ever heard of EMDR. She's a real asset to our team in Kelowna. Welcome, Dr. Sidhu.
Thanks for having me.
And we also have Suzanne Noel, who is our resident expert in accelerated resolution therapy. So that might be something that you've never heard of before. It's sort of, I don't want to use the word Botox of counseling, but I'm going to use the word Botox of counseling. People are kind of into that now. It used to be sort of EMDR, and people are still going towards EMDR. Now it's sort of the new EMDR. It's very different in terms of treatment, and we're going to explain that. But if you're someone who struggles with trauma or who has ever wanted to treat that, Suzanne Noel is a registered clinical counselor, and she works with us at Three Sisters Counseling as well in our Kelowna office. She has extensive training in ART, which is accelerated resolution therapy. She used to work as a nurse practitioner for many, many years and translated that into doing her master's in counseling psychology. So welcome, Suzanne Noel.
Thank you. Thank you for having me.
Yeah, no, it's great to have you guys here. So, I mean, when we talk about trauma, what is trauma, Dr. Sidhu? If you can just kind of describe, and this doesn't have to be a really in-depth explanation. It can just be sort of like for the lay person who's just wondering, do I have trauma? What is it?
That's a really good question. So simply put, trauma is a distressing event or series of events that can really overwhelm the central nervous system to the point where the individual isn't able to cope. And there may be a myriad of reasons that this occurs, whether it's a type of abuse or any risk or harm to that individual that can lead to long-standing psychological, emotional, and physical effects.
And that brings me actually, as you were speaking, I was thinking to myself, is that made worse, say, or are people more predisposed to, let's say, feeling the effects of a trauma because of their upbringing, let's say?
Yeah, I think that's an important point as well, because there can be two individuals that go through the same traumatic event and may process or cope with it quite differently. And so some of the factors that can contribute to this are things like getting timely access to services or good social support or having resiliency or really great coping skills. That seems to make quite a difference.
Thanks so much for that. I mean, we often think about trauma and kind of what it does to our mind and body. And I know when I see people in my practice specifically, and we all, work in the same practice, but we all have individual practices based on different things. I often talk to people about the effect on their body of their trauma. And there's a great book, as everybody knows in counseling, I shouldn't say everybody, but now you're going to know it as well, is The Body Keeps Its Score. And I've mentioned it several times because we often see the manifestation of trauma in our physical bodies. So how does trauma affect our mind and body?
Yeah. Let's start with the body, as you had mentioned. So again, with the effects, it can affect different parts of the brain. For example, the hippocampus, which is responsible for things like memory and learning. There's been studies that have shown even a shrinking in the hippocampus due to traumatic events.
Is that right?
Yeah, it has. And, working with different individuals, I've had people say, am I having dementia-related decline? And they've gone for cognitive testing, and there has been some shrinking of the hippocampus related more so to traumatic events because other physical causes were ruled out. So it really just shows you the depth of how trauma can affect us. And then also looking at the amygdala, which is responsible for things like emotional regulation, and then also our, responding to things like stressors and danger, which we know with trauma is really heightened. And then, it can have effects also in the prefrontal cortex, so things like decision making, impulsivity, and that's why we do tend to sometimes see an increase in high-risk behaviors associated with that, with traumatic events.
That's so interesting because when we think about trauma, I think many of us who are not psychologists and I mean, a registered clinical counselor, yes, we've done training, but we have not done that training. And I think, yes, maybe a little bit, but not to that extent. And I think it's so interesting to hear you say that because often we think about trauma in terms of the physical, I'm feeling stressed or I can't sleep, and we see the physical manifestations of it. But hearing that, it's actually really, when you talk about the biopsychosocial approach, that's biological, really, the things that you're talking about and the physical changes, right? And obviously there are many different ways of treating trauma. So when we look at, people have heard different things. Oh, I've tried this, you have to try this. And everyone's always excited about the new thing. And that kind of brings me to accelerated resolution therapy. And I know I was so excited to have Suzanne join our team because it's such a new thing that I had not heard of. And Suzanne was so excited and she's so passionate about it. So what is accelerated resolution therapy?
Accelerated resolution therapy, what we affectionately call ART, not to be confused with
art therapy, right? Yeah.
It's an evidence-based form of psychotherapy that is actually relatively new in the psychology world. It's only been around for about 20 years. And it is very similar in some ways to EMDR that Dr. Sidhu is going to talk about. And it's a therapy used to calm the distressing thoughts and feelings that you have related to an event. It could be a traumatic event. It could just be something negative that has happened that maybe you don't really think is trauma, but it's giving you some physiological reactions and maybe affecting the way you react to people. Maybe you get triggered easily in certain situations.
That's interesting you say that because I remember in training, I have my EMDR certificate, and I remember in training talking about sort of your, even going into that CBT realm, so that cognitive behavioral therapy realm of your reaction to something is more closely related to your past experiences than it is to the actual event itself, right?
It can be.
And I think that's sort of maybe, I don't want to say the definition of trauma because Dr. Sidhu gave such a great definition of trauma, but I have to say that is something that jumps to mind, right? Is how we react to things is often so closely related to our past, and people recognize their triggers, whether that's in relationships or otherwise, where someone might say something quite benign, actually, in nature, and you really have a visceral reaction to it. And I know I'm guilty of that too, because everyone has their past with things, and you think, well, what did you mean by that? And then the person says absolutely nothing, and it's really a result of, I've said before in my conversations with Jason about I like to think of people wearing a backpack, and your backpack is filled with all your past experiences and all of your traumas and all the things. And it can get quite heavy, actually, you know? And so I think it's important to process that or kind of unload the backpack and allow yourself to kind of have a bit of, let's say, levity or a decrease in the weight that you're carrying, right?
Yes. Yeah, I agree.
So in terms of, so that's accelerated resolution therapy and kind of what it is. So what types of issues can we use accelerated resolution therapy for? And I spell it all out like that because when I say art, we do have art therapists with us as well.
And
so
it's not art.
It's not art. Suzanne does not do art. No. So what types of issues can we expect to kind of work through? Because it's not just trauma. Is that correct?
That's right. And I think a lot of people hear the word trauma and they think, oh no, I haven't had any trauma. But the reality is certain experiences do tend to pile up over time, and which leads to traumatic responses to things. So it can be applied to anxiety, depression, complicated grief. They've recently done a study and found some benefits. It's also a really good adjunct to OCD treatment. It's not your first line treatment for OCD, but there are definitely some indications for it being used in so many different areas.
Now, just on that note, is it possible if it's used for sort of OCD treatment? I was talking earlier to someone about anxiety in kids. Could it be used just theoretically to treat sort of just generalized anxious behaviors in kids, do you feel like? And do they have to be kind of like a certain age to understand the ART concept?
Well, I think they would need to be able to understand how to visualize their problem.
Okay.
And they would need to be able to follow directions. But I think any child that could understand how to recreate a story or to follow a scene in their mind could probably do this. And although there isn't a specific protocol for children, I would personally probably just stick to children over 16. But yeah, it's definitely something that would be worth looking into.
Thanks for that. So going back to kind of Dr. Sidhu, tell me a little bit about EMDR. So this is something that you've practiced for how many years?
Yeah, for about five to 7
Okay,
years.
so that's quite a bit of time. So tell me a little bit about what is EMDR, and describing it for the people.
Yeah, so EMDR, or eye movement desensitization reprocessing therapy, is a way to kind of consolidate the traumatic events in a way that makes sense and that you can repair and move forward. So typically memories are stored smoothly, but with traumatic events, it's kind of like the brain goes offline and it doesn't allow the healing to occur. So with EMDR, it uses both bilateral stimulation, so either moving your eyes back and forth, or it could be a form of tapping or sound, as well as guided instruction to help reprocess or consolidate those memories. And so with doing that over time, the distress seems to go down. And so when you think about that event or traumatic events, it's no longer like you're reliving it, and the emotions associated with it are a lot more manageable.
That's interesting. And you know what jumps out to me when you said sort of just the repetitiveness of that, the eye movement or the tapping. And I know when I learned my EMDR training, and I did it with EMDRIA in Vancouver, and not to plug a certain thing, but I was very riveted actually by their treatment sort of teachings, I guess, because they were talking about people who had been involved in something like a plane crash or, you know, those types of things. And really the need as a very young child, like an infant, what does your mom or dad, I'm not going to, you know, could be either, do when you're upset as a child? You know, you're rocked, right? You're tapped. It's okay. You sort of breathe with me, and it creates that calm. So it's that repetitive, calm nature. And not that that is the principle of EMDR, but there's something to be said for that, right? It's that repetitive, calming feeling, and sort of bringing that experience to the forefront. And then almost, I mean, if we can think of it in terms of essay writing, if we can go back to school, it's almost like we bring up the essay again, we completely redefine it and we change it, and then we save, and then save it again. You know, it's just we change it a little bit. And I think that's something to be considered when we think of EMDR. Is just it's almost, it's not a rewriting and dismissing of a story, but it's allowing you to process it and actually go through it in a different experience than you had the first time. Would that be right?
No, that's an excellent point, and I agree, because what it helps you do is, for example, let's say an individual was in a car accident and an ambulance had come, and that was quite a traumatic experience for them. With the traumatic event, when you hear an ambulance, you go into fight, flight, danger. There's something wrong, I'm not okay, I'm not safe. But through the process of EMDR, you reform those connections that ambulance can be associated with helping or healthcare providers. And so you're really changing that whole, that story, as you mentioned.
Yeah, so it is almost like a rewriting in that way. So in terms of, if we look at the average person wanting to come in for EMDR or ART therapy, or ART, again, not to be confused with the creative, what does that actually look like for someone? So if I'm nervous and I want to come in for ART therapy, what does that actually look like? What do you do? What are you going to do with me when I'm there?
Well, an art session, it's unique because it works really well even in situations where you actually haven't got a therapist that you've been seeing for a long time. I don't need to know the details of what's happened. I don't need to know the story of what has caused the trauma or the distressing thoughts. When you come in to see me, you can introduce it a little bit to the level that you're comfortable. We usually spend 20 minutes or so at the beginning getting to know each other, if I don't already know you. And then from there, we'll go into you imagining a scene. And it's like, they describe it like a movie. So you're imagining the scene, and inevitably it's going to bring up those physiological reactions that we talked about because of the way the trauma was stored in your brain. So when you get those physiological reactions, we use the eye movements to calm the amygdala, which is in control of your fight or flight response. And interestingly, it does, and people are often very surprised. Oh, that feeling's gone. Okay. So then they continue seeing their scene. Once we've gone through it the first time that way, using the eye movements back and forth to calm that feeling, we then go through the scenario again. And the second time through, people will report that they have no negative reactions to reviewing that, or much less. And then we actually take advantage of that. We were talking earlier about the memory and how it's open for change. So we take that opportunity to then put in some positive thoughts along with that distressing memory. And before it's reconsolidated at the end of the session, you're now connecting positive feelings to an event that happened. So you're not actually changing the event. The event still happened. The car accident still happened. The ambulance was still there. But when you hear the ambulance siren, you're not having that reaction anymore. You think, oh, there's an ambulance, just like others would. And that's the purpose of this therapy. So the actual ART part of the session takes 40 to 60 minutes or so. And people will report by the time they leave that they feel lighter, or that they feel hope, or that they feel a little bit excited. The nice thing with the ART is that you leave at the end of the session and it's finished. It's a bit of it's a quicker approach than EMDR. It's typically 1 to 5 sessions, as opposed to EMDR, which I believe can be a little bit longer. I don't practice EMDR. So it's a very targeted approach, and it works very well to start peeling back layers if people don't want to make a really big commitment to looking at their trauma.
Now, that's interesting. So how many sessions would you do typically with EMDR, for example?
Yeah. I guess it really does depend on the individual. So we always start with an assessment and looking at how that traumatic event or events are affecting that person's view of themselves or the world. Again, when trauma happens, it can trigger all the other past trauma. So I think that is really dependent on how many sessions it may take. But I would say typically, I've seen some good change occur in 3 sessions, but I would say, it can be up to 12 sessions, for example.
And it's interesting you just said that about how, some trauma elicits, I can't remember exactly how you said it, but elicits sort of a response about something, and then other trauma might not. And that's the interesting part about it, is I just was saying that in one of my other episodes, talking about frontline trauma, is there are people who work in traumatic jobs every day and they see traumatic events. And a lot of the trauma they recount is actually not traumatic to them. So they can pass on the trauma to someone else, explaining, oh my gosh, guess what happened in my day? And someone who's not in healthcare or as an RCMP officer would say, oh my gosh, that's so traumatic. And they would be really affected by it. Whereas they just blow right through it because it's just what they're used to. However, there are always those few things that you see as being massively traumatic to you and very impactful. So it's interesting that trauma is not maybe an absolute tangible thing. It's specific to the person.
Yes.
I think there are definitely general things that generally everyone would find to be traumatic, correct? Right. So if we think about EMDR, describe kind of what that process would look like. So if someone didn't want to, say they listened to Suzanne and they thought, I don't know, I want to hear what EMDR is about. What's EMDR about when they come into the office with you?
Yeah. So like any type of session, it is finding out what the client wants to work on. And so typically we pick one distressing event, and then we examine how does that event affect how they see themselves, and how is that event contributed to that negative core belief, going back to like the first memory they may have of feeling that way, and then the worst memory they may have, and then the most recent memory. And then similarly to ART, they would hold that image. Again, they wouldn't need to talk about it if they didn't want to. And then you go through the protocol of either the eye movements or tapping or sound, and you continue to do that until the distress lessons. And then you also do want to replace it. So for example, my negative core belief is, I'm not capable, or I'm not worth it. We want to be able to replace that with I am capable. And with that confidence, it really helps us move through those traumatic events and rewrite that script.
And that's a common one. I often hear in therapy when people come in and they're not necessarily coming for EMDR or anything like that, but there's sort of negative core belief about themselves is I'm not good enough, or I haven't done enough, or I'm incapable, or I'm unworthy. And these are all things that we go through, EMDR specific, all these sort of different themes, a guilt theme or a shame theme or a survival theme or a protection theme. And we go through all of these things. And what's super interesting, and I actually find the cognitive part of EMDR very helpful on its own, even if you weren't to do any eye movement, just the cognitive part where you kind of go through and you say, wow, I didn't really realize that about myself, that I actually truly believe I'm not good enough, you know? And people don't recognize that as sort of the driving reason. And I've talked about it a lot in these episodes, but I certainly talk about it a lot in my sessions as well, is people's underlying narratives really drives their behavior. Right. So you and today I just had this, conversation with a friend of mine talking about parenting, and, we were talking about being a working mom and all the pressures we put on ourselves, for example, as working moms. And we were really talking about the idea of this underlying narrative of like, I need to keep up with, or I need to present an image of. And when you actually look at even those things, that's not necessarily related to trauma, but it's a negative core belief. And then if you get a traumatic experience that also sort of piggybacks onto that can be really, it's almost, I hate to use the word, it's in your DNA, because I know that's not what I mean, but it's really ingrained in your underlying narrative about yourself, right?
Definitely.
Yeah. So now, I think it's really interesting to think about, there's all these different options for how we treat our trauma. So how would we know, and honestly, either of you could answer this, is maybe you can jump in if you feel the need to, but how would you describe, kind of as we wrap up, how would I know if I need help for my trauma?
Yeah, well, I think, if there's any type of change in your daily functioning, for example, you start to have issues with sleep or appetite or feeling more down than usual, I think it's always best to err on the side of caution and just really get that checked out and maybe get a bit of an assessment to see how you're coping. I think regardless of if an individual develops PTSD or not, getting help to process through a difficult event is always helpful.
No, I would agree. And if anyone listening at all is struggling with any type of trauma, and really honestly anything else, anxiety, depression, anything that you're feeling has changed who you are or has affected how you've been in the past and has sort of impacted you, I do encourage you to reach out for counseling. We have a whole variety of people at Three Sisters Counseling that you can choose from. Obviously, everything from anxiety to depression to trauma to EMDR to ART, there's lots of different ways we can treat you. It is a pretty easy process. Go to www.threesisterscounseling.com and you can choose from either one of these lovely ladies or myself or any of the other 16 practitioners we have in both Kelowna and Vancouver. So thank you so much, both of you, for being on this session today. And thank you for watching. This is Mental Health Matters with Lisa Ann Butcher.